So I really know what it's like to suffer with pain and not be able to do what you want to do. And I know what it's like to go from doctor to doctor looking for solutions. I started out as a patient, and I was so blessed and fortunate in that a coworker referred me to her holistic doctor. And she transformed my life so much that she inspired me to go back to school to study natural health care. So that's why I do what I do, and that's how I got here. Patients want to be heard. They want to be understood, and they want someone who will listen. They're frustrated with 5 or 10-minute appointments that they're getting in traditional medicine. Not the fault of the doctors that they're seeing, but their doctors are constrained by the insurance industry. I think more and more people are understanding that prescription medications are really about the management of symptoms, and they really don't fix our physiology. I focus on identifying and addressing the root cause behind why we have symptoms. And I also empower patients that if they knew how to optimize their diet and their lifestyle, they can really heal themselves and resolve a lot of the symptoms that they have. People never know that they should invest in themselves before it's really bad. If you have no symptoms and you want to be preventive and proactive, or if you have mild symptoms and you really want to nip that in the bud, or if you have severe symptoms and you really need to transform your health, this approach works really well for all of those scenarios. So it's good to be thorough and careful with your health versus dabbling here, dabbling there, trying this and trying that. It's usually more cost effective to just do it right from the first. I'm going to listen to all of the details about their symptoms, about what they have experienced so far, and I'm really going to develop a partnership with them so that we can figure out the solutions together. So that I do the right diagnostic testing and enough diagnostic testing so that patients can really understand what's going on with their body. Because I really want to make sure that we have a roadmap and we have a way to get from where we're starting and get patients to their goals and get them to the finish line. The typical patient that I work with is probably in the 40 to 60 age range, and they're at a point where now it's time to take care of themselves. They know that they're not feeling their best. They're worried about the effects of aging. Maybe they've gained some weight, and no matter what they do, they can't get that weight off. Their energy is lower, and they're not getting answers from their doctors. I would say to anyone who has a chronic symptom or a chronic pain that they should keep asking the question why, and they should keep looking for a solution, because if they haven't found a solution, they just haven't found it yet. So I would absolutely welcome you to look at my website, buildtruewellness.com. And if this approach makes sense to you, then let's schedule a discovery call so that together we can figure out if we are a good fit to work together.